Assalamualaikum everyone, welcome back to this channel. This is me Arivahid and you are on the channel of Medicare. So as you know, we have started the lectures of pathology, and in this lecture, in the previous lecture we have started the inflammation. We have covered all the things about the acute inflammation in various subdivided lectures, and then we have started the chronic inflammation and we have completed it in the previous lecture. In today's lecture we are going to start the tissue repair, which is the last step of your inflammation. So restoration back of the tissue is called the repairing, or you can call it also the healing. So we restored all our things. Restore. We restored the structure as well as the functional capability of that tissue. So this is called the healing process. Now our tissue repair, it consists of mainly two process. Can it can has three types, but the mainly two types of processes are occurring in the tissue repair. So if someone can ask you that how much processes are occurring in it, so you have to tell them that two processes are there that occurring in this tissue repair. First is the regeneration, and second a process that occurring in it is the scar formation. So first thing is the regeneration mean replacement, that your injured tissue replaced by the normal cells, and to restore its function and to restore its structure also. Second process that occur in the tissue repair is the scar formation. And when we have a severe injury and if the regeneration cannot occur at that site, then the scar form. And scar always form by the deposition of collagen and some connective tissue at the site of injury, and they will form a scar which is clearly observable. Whenever on your skin if you have a scar, it remains till your lifetime. Okay, so these are the scars. While regeneration, it totally restore the normal process, and we cannot differentiate whether this person has the injury at this site or not. But regeneration is look like the similar, but the scar formation show clear or visible signs. And when we see the scar, we can clearly observe that this person has injury at that site in at his some lifetime. So these are the two processes by which your tissue repair is conducting. Now we have three types of tissue repair. First type is the regeneration. In regeneration, the proliferation of your stem cells and your residual cell is occurring. And regeneration is always occurring in those cells which have capability to divide, which are the rapidly dividing cells. Which cells are dividing in our body, like let's suppose the skin cells are mostly dividing. And like when you wash your hands, and you don't know, but a lot of cells of our hand are washed off, they removed off, and that's why the skin cells are continuously dividing and they give you a new layer of skin. So this type of regeneration is occurring within our skin cells. Similarly, in the epithelium of intestine, same thing is happening there. But the scar formation, this occur at those sites where regeneration is not possible. Okay, and when your scar is formed, its structure can be similar to the normal tissue, but it cannot perform the function as the normal tissue was performing there. Okay, so these kind of things are occurring. Third type of your tissue repair can be fibrosis. And you know about the fibrosis, that excessive deposition of collagen or fibroblast cells at the site of the injury. And fibrosis always after the chronic injury or chronic inflammation, and after the very severe kind of ischemic necrosis. So after the chronic injury or after the ischemic necrosis, the fibrosis will occur, and the most common sites at which the fibrosis can occur are like liver, kidney, can be myocardium, can be. So these are the major part, the major organs in which fibrosis can occur, and the most famous fibrosis is of the lungs fibrosis, which is also occurred through a drug which is called busulfan. So this is the question that is mostly asked in the competitive exams, so you have to clearly make the concept within your mind of it. So mostly the fibrosis can occur within your lungs, within your liver, so you should know about it, within your kidney, all the major organs of us in which the fibrosis can occur in the myocardium. Okay, so these are the three types of your tissue repair, and you should know about it. So now you're inside your tissue repair, all uh, the cell proliferate, like in regeneration the dividing cells, they become divide, they proliferate themselves, and which type of cells proliferate themselves, all the residual cells, or you can call them the stem cells. Dividing stem, you can call it at the residual cells, or you can thirdly call it stem cells. All the things are same. Similarly, in making the fibrosis, the fibroblast is the major cell that is producing the fibrosis, while the residual cell and stem cells, they are causing the regeneration, and the scar formation is done by your what kind of cells, it is done by your collagen and connective tissues. Okay, now as you know, our cell cycle is, our cell has a transition. Like if we talk about the dividing cells, so all the cells are not dividing, some cells are in G0 phase. In G0 phase they are in the rest phase, but the phases of cell cycle like G1 phase, G2 phase, S phase, M phase, in these all the phases, the cell is actively dividing. But in G0 phase the cell is in the rest phase, it cannot divide. And the parts of our body in which our cell cannot divide, at that site regeneration cannot occur. Then if the injury at that site occur, then whether the scar will form there, whether the fibrosis can occur there, but regeneration is always occurring at the site where the cell are dividing, where the cell have the capability to divide themselves. Okay, so this was the major point. Now we have three types of tissue proliferation within your our body, because of the three types of cells are present within our body. As I've explained, some cells are dividing and some cannot divide. First type of the tissue that present is the liable. Liable are those cells which are continuously dividing, they can have the ability to divide themselves. Like I have explained to you, like the skin epithelium, like the intestinal epithelium, like the hematopoietic cells, which are the present in our bone marrow, and they help in the production of blood cells. Similarly, second type of the tissues that are present in our body is the stable tissues, or you can call it a second name which is quiescent tissues. So these kind of tissue, they have limited regeneration capability, but they proliferate but in response to the injury. For example, your liver, whenever the stimuli of injury came above them, then they have the ability to restore or repair. Okay, like the kidney can be repaired after the injury, and pancreas can be repaired after the injury, so the injury is important for their repair. Okay, so the third are the permanent tissues which can't divide. They have no ability to regenerate, and they will form a scar after injury. If the injury occur between them, they will form a scar. They cannot regenerate or repair. For example, the cells of your neurons, and especially the heart muscle cells, they are permanent. If they undergo a injury process or a damage process, they cannot return back. So these kind of cells are also present within your our body, so you should know about them. So now let's talk about the stem cells or some kind of regenerative cells that are present in our body. After that, we will discuss how the restoration is occurring. So let's talk about all the types of stem cells or residual cells can be given any name. So stem cells, first kind of cells that are present in our body is the hematopoietic stem cells. These are the cells that are present in our bone marrow and they are forming a lot of blood cells as I explained. Second type of the stem cells that are present are the mesenchymal, sorry, one L is there, chimal stem cells. Okay, so they are, these kind of stem cells differentiate and become three types of the cell. The first type is the chondroblast. All the name will end with the blast word. Second is the osteoblast, and last is the myoblast. Okay, mesenchymal cell divide into the differentiate into the three types: chondroblast, osteoblast, and myeloblast. Okay, some other types of the stem cells are like embryonic stem cells. So they have extensive self renewal capacity and they can differentiate into all types of the cells. All types like mesenchyma have only capability to divide into these three, but embryonic cells can regenerate into all cells. And challenge is that immune rejection can occur in it. Last type of the cell are the adult stem cells. Okay, so these are found in the specialized portions like the bone marrow and the skin, and they can do the organ repairing process and the regeneration. So these are the some types of stem cells that are present here, and they are differentiating and making our body to regenerate and repair after a injury. So now we need two things to proliferate. First thing is our stem cells. Second thing is we need growth factor, and third thing we also need the ECM. What is ECM? It is extracellular matrix. So we need how much kind of things here to regenerate or restore. For regeneration, we need three things. First, your stem cells. How much types of stem cells are we have studied now. Second thing that you need is the growth factors. They will allow your all the stem cells to stimulate and to grow. And third thing that also affect the regeneration is your ECM, extracellular matrix. Now we study about the growth factors. So growth factor, they actually acting as a stimuli. They will stimulate your cells to grow, to migrate, to differentiate, to do all the kind of proliferation. And you have some examples of the growth factors. For example, let's talk about the examples of the growth factor. The first example is EGF. And now what is EGF? Okay, EGF is the endothelial growth factor. Endothelial growth factor. So it it is used for the mitogenic, mean doing the mitosis. So it stimulate the process, stimulate the M phase of your cell cycle. Second type of growth factor is VEGF. It is the vascular endothelial growth factor. So it is promoting the endothelial cells that are present within your vessels to grow. Okay, so it is causing the growth of your vessels. Next example of your tissue growth factor is the TGF beta. So these encourage the ECM synthesis. ECM means extracellular matrix, so it is indirectly promoting the ECM to grow more. Okay. Okay, so now what kind of growth receptors are present within our body? So we have three types of the factor receptors. Okay, we have studied the examples of growth factor. Now we will study the receptors of growth factor, its receptor. So the first receptor it has is the G protein coupled receptor is there. So it activates in response to CAMP and the calcium influx. These two things stimulate the G protein coupled receptor to stimulate and work. Second receptor that important for it is the intrinsic tyrosine kinase. ठीक है, the second receptor is the tyrosine kinase. Okay, so now this tyrosine kinase stimulates in response to some kinases, and the growth factor will bind to this receptor and show it activity. Third is the intrinsic enzymatic activity, like the cytokines are there that play important role in this part. So these are the three types of the growth factor that is playing important role in this part. Now we move toward the third part, which is the ECM, extracellular matrix. Now why ECM is important? ठीक है, because it is doing the functional support to our tissue repair. It's supporting the tissue repair process. It is also controlling the cellular proliferation, and it is important for the regeneration. Without it, regeneration cannot occur. So that's why ECM, extracellular matrix, is so important. Now your ECM has two forms of ECM. It has two forms. First form is the interstitial matrix. Okay, first thing is that this matrix is mostly found in the connective tissues. Okay, in the connective tissues, and it is composed of a lot of kind of proteins like collagen,